So first, let's look at some definitions of health-seeking behavior. Originally, the definition of health-seeking behavior, any action undertaken by individuals who perceive themselves to have a health problem or to be ill for the purpose of finding an appropriate remedy. In this definition, the patient is reacting to perceived malady. So this form is more reactive. I think the more current definition of health seeking is the more proactive one. Ways in which individuals seek information about their health, risks, illnesses, and health protective behaviors. More and more patients are going online to look up healthy lifestyles, diet, exercise, um, disease prevention. Okay, now let's look at the demographics of the online health seeking patient. Research has shown that people who look up online health information are adults who, in the past 12 months, have provided unpaid care to a parent, child, friend, or other loved one. This makes sense because 50% of health related searches are done on behalf of another person. Women, I think that relates back to the first one. Women tend to be the caregivers in their family. White people, adults between the ages of 18 and 49, which makes sense. Adults with at least some college education. I think a lot of health information can be confusing, and it helps to have a higher degree. Adults living in a higher income households. I think this probably relates to the availability of online devices and having several of them at your disposal. Okay, now let's take a look at how people are searching for health information online. So estimates show that 72% of internet users say they looked for online health information in the past year. I've seen this number as high as 80%. And like I said before, half of all online health searches are on behalf of someone else. 77% of online health seekers say they started with a popular search engine. The issues with this is that you're not guaranteed a reliable source, and a lot of people have trouble determining reliable sources from unreliable sources. But in 2014, Google paired up with the Mayo Clinic and came up with this feature dubbed Dr. Google. So if you search a health term in Google, a little pop-up screen comes up giving you some basic information about a condition. The problem with this is it doesn't tell you if you have it or not. It just tells you about the condition. 13% say they began at a site that specializes in health information like WebMD. This is obviously a much better way of searching. 2% say they started the research on a more general site like Wikipedia. And 1% say they started on a social network site like Facebook. I actually thought that would have been higher. Okay, so health information is the third most popular thing searched online. And people who did searches for health, here are the main things that they looked up. Something about a specific disease or medical problem, a treatment or procedure, how to lose weight, health insurance, that makes sense, food safety recalls, and you can look down the list. Okay, so we just saw that the most common health search was about a specific disease or ailment. And invariably, when users do this, they have a tendency to self-diagnose. So 46% of online diagnosers say that their condition needed attention of a doctor. 38% say it could be taken care of at home, and 11% said it was either both or in between. So this shows me that actually looking up behavior may lead to seeking out a physician's care instead of preventing it. Okay, so let's look at how accurate self-diagnosing has been. Only 41% of online diagnosers say a medical professional confirmed their suspicions. An additional 2% say they partially confirmed them. I'm not sure what that means. 35% say did they not visit a doctor. 18% say a medical professional either did not agree or offered a different opinion. And 1% say their conversation with the clinician was inconclusive. So not extremely accurate. Okay, a common practice of patients is to actually go online before they have a doctor's visit. And they do this for several reasons. Medical terminology can be rather complex. So a lot of patients search things so that they would be more familiar with terminology and be better able to communicate and understand what the physician was telling them. They wanted to be able to provide relevant information. So, maybe if a certain illness had like a family history, they could bring that information in and not be put on the spot in the office to be more involved in their healthcare process. So offer some advice that they've seen online, increase confidence, to avoid information overload so they can kind of get some information ahead of time and then get more information and clarity from their physician, but not having to get it all at once. And take advantage of time constraints. A lot of patients said that they didn't feel like they had enough time to understand or process all the information their physicians were giving them, and to decrease their anxiety so they wouldn't be anxious the whole time up until the visit. In terms of physicians' perspectives towards patients going online before a visit, physicians responded favorably when they thought that the patients, had access quality information and the patients actually understood its relevance and were able to evaluate it. Physicians encouraged patients to seek information online about pre-existing conditions instead of self-diagnosing. Although a lot of patients sought online information before a doctor visit, not all of them shared that information with their doctor, and they did this for several reasons. They didn't want to overstep their bounds. They felt they might be interfering in the diagnosis process. Patients were worried that doctors might get offended and that would reduce the quality of their care. Patients didn't feel confident in their ability to evaluate the information they had seen, and they didn't want to be embarrassed. Patients didn't feel the information was important enough, or patients didn't feel that there was enough time. Patients were more likely to share their online findings with their doctor if a family member was present at the visit, if a doctor asked them a lot of specific questions about what they knew about their malady, and if patients had encountered a treatment-related ad that suggested talking with a doctor. When patients did share, they used some specific strategies. They would ask additional questions. They would make suggestions based on online findings without necessarily saying that that's where they had gotten the information. Sometimes they would directly disclose that they had found things online. Sometimes they would be very passive and just verify silently without asking any questions. And some people would say that they went online and they would also bring handouts for their physician. I think the health belief model is a good way to represent when a patient decides to look for information online, and then if they decide to continue and to see a physician, or if they look for information online and have to decide when they see a physician if they're going to share that information with the physician. As we know, um, age, sex, ethnicity, and socioeconomic and knowledge played a big role in who was seeking information online. Um, and then whether they actually went to the doctor and shared these findings were based on whether the patients thought that they would be received well by the physician or if they were encouraged to do so. Okay, so here are the results. So when patients looked up information online, that did not preclude them from seeking out advice from a doctor. A lot of times it served as the impetus. Patient satisfaction was unrelated to if their doctor's diagnosis matched their own. That didn't matter. What mattered to the patients was whether or not they took their online searches into consideration. And if they did that and they listened to them and they didn't agree with them, patients were grateful for the doctor's feedback. Patients who shared information with their doctor looked on their visit more favorably. They felt they got more out of it. And originally, a lot of doctors had some concerns over patients bringing in misinformation and doctors having to, spend a lot of time correcting it and explaining it to them. But overall, that didn't seem to play a huge part in affecting the relationship. Um, Most of the time, doctors and patients looked favorably upon patients bringing in information from the internet and felt like it allowed them both to collaborate more to provide better health care. Okay, so why do we care about all this? Well, we've already shown that when a patient is able to find quality information online and correctly evaluate it, it leads to better communication with their physician, and that leads to better health outcomes and patients being able to take a bigger role in managing their health. Unfortunately, extremely large part of the population has very low e-health literacy skills. E-health literacy is the ability to seek, find, understand, appraise health information from electronic sources and apply the knowledge gained to addressing or solving a health problem. What's complicated about e-literacy is that it includes all these other literacies. So as people at risk for having low e-literacy are older adults, immigrant populations, minority populations, and low-income populations. So as librarians, we need to be proactive in helping these people. We can partner with community health agencies and offer free screening. We can show patrons reputable online health websites. We can help them interpret confusing knowledge. We can have health community days. Everything to make sure that our